Fiona Bull is the Program Manager of the Surveillance and Population-Based Prevention Unit in the Department of Prevention of Non-Communicable Diseases at the World Health Organization. This is in Geneva, Switzerland. Fiona commenced this position just this year, January 2017. The focus of the unit is on the development and dissemination of evidence-based guidance and providing technical support to whole countries on the implementation of population-based approaches to healthy eating, physical activity, and the prevention of obesity. Dr. Bull joined WHO from the University of Western Australia, where she held the positions of Professor of Public Health and Director of the Centre for the Built Environment and Health. This is for the past 7 years. Hey, we're really fortunate to have a lady with such a wealth of experience across the world. And in the brief bit of research I did yesterday, Fiona, you appear to be someone who actually takes no bull. So welcome to the stage. Please share with us partnerships for a more active world, how getting more people active is a win for global and local health. Kia ora, Fiona.
Kia ora. Good morning. Bonjour. I'm practicing my French now that I've relocated to Geneva, and as the kind introduction indicated, only in January this year. But it's a great pleasure to join you here. It was nearly 2 years ago, I think, Chelsea, when I received an invitation to come to New Zealand, and I was delighted because I've lived in Australia for around, on and off now, for nearly 20 years. And I'd never been invited to New Zealand. So I was delighted to accept that. It's just that 4 months before the event, I moved to Switzerland. So I've actually travelled from Switzerland and made it part of my contract of employment that I needed to come back to New Zealand to honour my commitment to be here with you. But it's a great pleasure because I've already heard a sense of what you've been discussing yesterday and your work and the statistics on the nature of your work. It's very important to me because it shows me that not only are you all interested in physical activity, but it alerted me to the fact that it's not always all of your job. So it's part of your work, and what I hope today is to give you information that you can use in your work. But I'd like to give you an overview of the big picture, certainly from where I look now at the global level to what's happening, and bring it right down to tools you can use in your work. I'll just get organised here with the clicker, and there it is. So I've arrived from Geneva, leaving a meeting known as the World Health Assembly, and it's underway. In fact, it was still working late last night, and early this morning when I woke up rather too early at 4 a.m, I was able to check in. But the photo at the bottom there is showing you just a snapshot of the World Health Assembly, where 194 ministers of health and their representatives meet annually to make decisions, discuss and direct the future work in global health. And it comes all the way down to some things that happen and affect us at the country level and at the local level. The top two photographs show you my current boss and my future boss. Dr. Margaret Chan on the right-hand side is the current Director General, and she retires in 1 month. And Dr. Tedros, the first appointee from the African region, commences on the 1st of January as the new Director General. So it's very exciting times, a new boss at the World Health Organization, a new agenda which will be shaped, and I'm sure slightly different because people bring different perspectives. But what I'm certainly sure and hoping is that physical activity remains part of the core work in the NCD area, and part of NCD remains a core part of the global health agenda, and you'll see why. I've put on the right-hand side just 3 documents which are being discussed. I told you it was exciting, and I was awake at 4 a.m. looking at the news and emails coming through from my colleagues. And that's because what was happening was the passage of these first 2 documents. The first one at the back there is the reporting on progress in global health on preventing non-communicable disease, chronic disease, coronary heart disease, strokes, cancers, diabetes. And I'm delighted to say it was passed and endorsed by all member states. And what's critical to it is a very boring document called Appendix 3. But Appendix 3 of that document gives you the best effective interventions that we should be focusing on and doing. So I want to make sure that you note that, and perhaps that could be circulated in one of your newsletters, that you need to all have a look at that. I'll be talking about some of that today. But Appendix 3 is the product of a lot of work to say we've got limited time, limited money, what are the best interventions that work and are cost effective? And that's been listed for all different areas: smoking, alcohol, diet and physical activity. The second document there is Ending Childhood Obesity, and this has been a major piece of work, which would be another presentation, but briefly, is looking at how we collectively are going to address the rising levels of obesity and the concerning levels of obesity in young children and adolescents. This report is under the Commission for Ending Childhood Obesity. The Commission's report was 2015, and this is the implementation plan. And I mentioned this 4 a.m. email because it was tricky. This one did not pass so smoothly, because in there it's got some very hard-hitting recommendations: marketing restrictions, taxation, regulations. And so there are countries who are a bit uncomfortable with bringing in such hard-hitting, effective interventions. And they wanted to water down this acknowledgement. They wanted to perhaps try and push this one under the carpet. But other countries that are pushing ahead with marketing restrictions, with food labelling front of pack, and with taxation on sugar-sweetened beverages, for example, they fought and defended the strength of the wording and the positioning of these cases. And it went through at about 5:30 this morning. So and I was telling Boyd over breakfast at 7:30, this is really important, because that gives each of you, New Zealand and everyone working here and elsewhere, the opportunity to use that with your government to discuss these challenging measures and to discuss how they should be implemented, and working with industry in partnership. But we must address some of the challenging environments in which pricing, marketing and promotion of unhealthy foods is changing our diets and leading to disease. So with that introduction, let me just expand on the areas of work I lead in World Health Organization. They were briefly mentioned. My remit is like many of yours, in fact. I have a unit which looks at healthy eating and unhealthy eating, physical activity, which is really physical inactivity, and of course the consequences, in this case, the obesity agendas. I have a team of about 10 or 11 people, and we work with education, regulation and legislation, and the environment to create supporting settings. So I suspect that reflects many of your areas of interest and your areas of work. What do we do at WHO? Well, we lead the work in developing global consensus, like those documents I've just referred to, and then developing tools for you, tools for countries and those within countries who wish to work on different topics. How do we do things? And that's our job, to create tools that other countries then can adapt and tailor to your context. Of course, we need to help countries build capacity, and in New Zealand, look at this room full of all of you, but there are other countries where there's far fewer. And so we do focus on those countries that need more help and respond to their requests through technical assistance and helping. And particularly requesting countries where there is expertise to help their neighbours and to help other countries progress in the same directions. So more specifically, in the area of unhealthy eating, I've just mentioned fiscal approaches, the marketing, and looking at salt and the reduction of salt in a number of different strategies, and of course work on fats, saturated fats and trans fats. In the area of obesity, given our mandate passed at 5 a.m. this morning, we now have full work to do the next coming years on disseminating, supporting and helping the strategies in that document. And of course today I'm going to be talking to you about our work on physical activity in particular. I want to set the scene, though, for some of you who perhaps are relatively new to this field or perhaps don't follow it as intensely as I have, as it's been my main focus for many years. But I want to say that in some ways this is still a relatively early area. Think of tobacco, which we're celebrating today with No Tobacco Day. It had a long history, and it's certainly shown us and leads us into some of the strategies and approaches. For physical activity, a landmark document was the 1996 Physical Activity Surgeon General's report. It brought the science together and gave us the platform of consensus about the relationships between physical activity and disease and well-being. That was then led some years later by the first global strategy from WHO. It took them a few years, but in 2004 they too agreed with the science and developed a diet and physical activity strategy. Tools followed to help implementation. A little bit later, you might be looking at these dates. Seems to take some time, and I hope I might be able to expedite things in the future. And then it wasn't until 2010 that we had global guidelines. Guidelines that told us, confirmed, how much should we be recommending to adults, to parents, to children? How much and of what type? And I know New Zealand has these guidelines, and indeed you're one step ahead, and I'll speak to that later in the presentation. The bottom row shows you much more current political and strategic agendas, which is useful for you to know. The bottom left is showing you in 2011 that there was a UN meeting, the high-level meeting at the United Nations in New York on this topic, on the topic of chronic disease. Can you put your hands up if you're aware of that meeting? Just a few of you in this audience. This meeting held in New York by the UN was only the second time the UN had met on a health issue. The first time it met, some years earlier, was on AIDS and HIV. When that was reaching the level of severity and concern, the UN said we need to meet to globally plan our strategy and reactions and responses. The second time was on the topic that I think concerns us, non-communicable disease. They met and they put out a strategy and a directive that I'll talk to in a moment that led to these next events, which is the Global Action Plan and subsequent work. And I'll talk to the last two aspects because they're unfolding now as we make sense of the new Sustainable Development Goals, which followed the Millennium Development Goals, and our work and how it fits in. So progress has been made, and in the area specific of physical activity, we've made good progress, and you can quickly scan all those areas which I've listed. I won't go through them, but to sample them, we've got surveillance and measurement and tools and guidance. We're doing quite well, and we've got evidence up to here. We've even got special issues in the Lancet. The evidence is strong to support your work. But, there's always a but. But we don't seem to be putting it into action. We have to work now at taking that evidence, which predominantly researchers generate, they publish it, but it's the hard work that then starts to implement it in communities, which I know is the focus of your work, and I want to help and share what's going on. And the other but here is we're not making much progress. Global levels of physical inactivity are currently 23%, which means 1 in 4 adults is not receiving or doing enough physical activity to get the minimum benefits. And we know there are more benefits, but they're not even getting the minimum benefits. I'm sure you all know the recommendations of 150 minutes a week, or 5 times 30, as it often is said. But look at the other number. Adolescents. That's 4 out of 5. Adolescents are now not meeting the 1 hour a day. So on the one hand, we know the benefits, and on the other, we've got a problem that they're not active. Now, here in New Zealand, I understand your data are for adults around 50%. So 50% are getting at least the minimum level, but 50% aren't. So our work is really quite a task ahead of us. So in this presentation, I want to give you a little look from the sky of the global health picture, very briefly, move into some of the physical activity data globally, then look at my work and the work of WHO and how it can help you, what we're doing over the next little while, and then talk about how you're implementing and share with you some of the ideas, evidence and practice that's going on. And I've got a pretty tall order here with the clock ticking into the panel session, but I've been given 5 extra minutes by the coordinator here. So let's get started. I mentioned the levels of physical activity already, but let's step back and just remind ourselves, after all, WHO's main job is to monitor health in the world, and it does that very well. And we have around 56 million deaths each year, and over 70% of those are from non-communicable disease. They can be accounted for by cancer, stroke, diabetes, and pulmonary disease. Stutter. This is staggering. It exceeds the communicable diseases by several-fold. Budgets are the complete reverse. The budgets are going into the other areas, and far too little is going into supporting work in this field. Let's have a look at those data in a little bit more detail. And here you can see those 40 million deaths due to NCDs now broken down by age groups. And look at the red columns. So we know we're going to die of something. And in the 70 year, let me just see whether I do have a... No, I don't have a pointer. I don't. The far side of the thing, the large red bar chart, you can see the... Oh, you stole it. Ah, there we go. That's better. Now I can help us both, if that works. There we go. I'll have to use this one. So you can see, of course, a very large amount is in the older age. But our focus and concern is here. This is 30 to 69 years of age. Those who are working in productive and important age, and we have got 15 million deaths due to the 4 diseases I've mentioned. They are largely preventable. This is important for health. It's important for countries. It's important for economic issues, development issues, social and community issues. We are losing 15 million people in the most productive years of their lives, and we could prevent them. Where are they occurring? Here we can look at the low-income, middle-income and high-income countries, and you can see that nearly 80% of them is in the middle-income countries. China's, India's, Brazil's. These countries which are going through rapid development are also now experiencing the largest growth and largest numbers of deaths in that age group I've mentioned of premature deaths. Coming closer to home, to here in the West Pacific region and, of course, the Southeast Asia region, you can see that nearly 60% fall within this region. So this starts to give you a perspective that what you're working on here in New Zealand is also common and connected to your neighbouring countries, which are also working on those same issues. I mentioned the high-level political meeting. This was held in September 2011. Why was it so important? It was important because it called for and recognised the need for us to work in partnership, whole-of-government approach. It also recognised the importance of the risk factors, our work. It called for modifying those risk factors, working together to address unhealthy eating and physical inactivity. And in the last paragraph here, it called and outlined who should be involved. The health sector working with local government, working with transport and environment, working with the sports sector. So it's given us at the highest level recognition of the need to get out of our silos. Health can't solve this on our own. We must work, as your theme of this meeting, work together. In the big picture, I've mentioned that political meeting down here in 2011, and our work continues. We're very focused on this point, which is halfway to 2025, when we've got to report on goals that were set up following that meeting. Goals that set us targets, focused our eyes on what are we trying to achieve. And what are we trying to achieve? Progress in these risk factors because they're associated with these diseases. The goals themselves are listed very clearly. Many of you would be familiar with them. And the particular one up there is the physical inactivity. We want a 10% improvement. 10% improvement in physical activity in the next 10 years, or by 2025. I've also highlighted that there is relationships with tobacco, because we know that physical activity and tobacco are related. You're less likely to smoke if you're physically active. Non-smokers are more likely to be active. Halting the rise of obesity and addressing blood pressure. So physical activity offers more than just one goal. It can actually contribute to achieving other targets. So how are we doing? Is the world on track to reach these goals set for 2025? Well, Margaret Chan, as she gave her final address to the World Health Assembly on last Monday, no, we're not on track. We will not achieve those targets unless we change what we're doing. Scale up, do better, invest, because we are not on track, because we're not doing enough. Are health outcomes improving? Yes, but, there's another but, because it's not fast enough. There has been progress in the last few years in several areas, but not enough to make 2025 goals. Remarkable progress, Margaret Chan says, even in some of the poorest countries, but bolder measures are needed. That's the polite way of saying we've got to do a lot more. Now, the chap on the right is the editor of The Lancet, and he looks a little more cynically at the area. And his remark is, the NCD community needs an electric shock to its semi-comatose soul. But who has the courage to deliver it? We are simply sitting and watching, discussing and debating, and the years are ticking by. So how active are we? I've already given you one headline data. Let's have a look at that from a global perspective. You can see the 23%, 1 in 4 in the red line, red horizontal line. And across the bottom, you can see the WHO regions, which start to show you that the problem is larger in some regions, mostly the Americas, so North and South America, in the Middle East, in terms of the Eastern Mediterranean region, in Europe. In fact, it's only in Southeast Asia where physical inactivity is actually lower than the global norm. Here, New Zealand sits in the West Pacific region, and again, we're higher, and of course, recognising the problem here in this conference. A concern is looking at the other side of this chart, where you can see economic development, a measure of GDP, high income, middle income, and low income, and look at the trend in inactivity. The more wealthy, the more developed, the less active. So we've got a concern here, one that's showing us that things are going in the wrong direction unless we start to change some of the fundamental determinants of physical inactivity, which we'll discuss now. We get more inactive with age, and that's true in every region. So the older you are, the less active, which speaks to you as a priority group, your older adults, the older community. And locally, we can start to see, and you'll have access to these slides, but here are some of your neighbouring countries. And you can see New Zealand here, and New Zealand is sitting quite high in the level of inactivity, and neighbouring countries are also high. So I'm sure there's an opportunity to share learning and to support each other through networks such as this. In terms of inactivity in adolescence, the 4 out of 5 children, there's no New Zealand data here, but again, you can see in some of the Pacific Islands, some of the neighbouring countries in the West Pacific region, they're very high, just like the data would show. And then this data is showing us how they're tracking in adults and in trends in adults and children. And you can see how, whilst the adolescents are here at 80%, we can see that the dotted line is showing us that it's increasing in inactivity in adults. All this data provides the backdrop for us to work on physical activity. Physical activity because of all these health benefits. Physical activity because we know the benefits are more with more exercise, and we have the guidelines in New Zealand to base our work on here in New Zealand. We know it's important amongst other risk factors, and we really need to take the problem to the next level. We need to understand how to change behaviour if we're going to be effective in our work. And to be effective, we need to think about the causes and the causes of the causes. A lovely expression that came from Michael Marmot in his social determinants work. We know this side. I've just shown you lots of data. Health is really good at going on about that part of the problem. This is the side we've got to focus on. This is what your work is. What is causing inactivity in this domain? I bet many of you have seen this diagram. The diagram that shows us it's not just about the individual, their motivation. We have to think beyond that to the social, the family, the cultural, the broader environment, the built environment, and the larger systems that Boyd was talking about yesterday that are influencing our choices, our opportunities. In fact, systems thinking, I think, has been neglected in the area of physical activity. You're expected to deliver a change in physical activity in your community with 1 or 2 programs. Can you do it? No one has put their hand up because it's a very big ask. Can we do it together with multiple interventions, interacting and synergies that add and multiply? Do you think that sounds like a better way forward? Do you think that sounds like a better way forward? Thank you. But let's look at the environment, because it's the environment that has actually had the most area of research, new research in recent times. And just looking at that, that's your city, unpacked. Where are the people living? The parks, the schools, the shops, the cycleways, the opportunities, the sports facilities. We need to look at this level of detail in combination with your programs to have effective interventions. And what we've learnt from this level of research is that places like this may not be good enough to walk in, may not motivate people, may not provide the safe, I can't see a pavement on that road. Would you send a child to go and play, be active for an hour a day? In that part, there's one swing. What about this? Would your child walk to school? This is the environment. This is the reality in many places. This is what's happening, I think, in New Zealand, certainly Australia, and absolutely in America and elsewhere. We are creating environments that actually do not provide the facilities and opportunities that are accessible and safe to be active and live an active lifestyle. But we can change that. Evidence has shown from research that my research centre and elsewhere has found that if we have the parks, we walk more. If we have the streets that are designed with shorter block lengths, with footpaths, we walk more. It's a no-brainer. But seemingly, we actually have to produce these evidence to convince our Department of Transport, our Department of Planning, our Department of Health, our Department of Sport, to realise it matters where you put things. We must protect our paths. We must provide the right streetscapes. If you want more information on this, it's going to be at this location as well as elsewhere. And there's lots of reports that show us that if we get the design right, we can actually improve walking and physical activity levels. You'll be very interested perhaps to use this resource from Western Australia, which is all about healthy active living by design. There's the website you'll be able to get later on. Books and resources are out there. We can change streets. We can reverse and improve our current environment, and we can build better in the future. Have a look at this. I'll do it again. Would you walk there? Think about your work. Who would you need to be involved with you to make the next change? Any suggestions? Shout out a change. Kay, can you see a change? Cycleway has been provided. Department of Transport, come and join me. Next one. Trees. Whoever's in charge of trees. Local municipality, come and plant some trees. Next one. Lighting. Who puts the lights in? Find out. Let's get lighting to make it safe. Next one. Hold on one sec. Public transport. Let's make sure it services the area, it's regular, it's frequent, it's affordable, and it's a good service. What was the one at the back? Bike shops. I can't see the bike shop, that's why I'm confused. Absolutely right, we have got a cyclist. And then, what more do I need now? Some more paint, because I've got a crossroad. What does that say to you? It says this is a place where pedestrians are. Cars slow down. It's amazing. We know it. Other countries know it. We need to do more of it. We've also changed the use of it. No longer a car yard. It's actually a shop. People work there. People are out. More people out, more people walk, more people cycle. You see people. It's safer. These are simple, effective ways to make places more walkable. Here again, typical suburb in Perth. So I hate to say that the Minister of Health, I'm more interested in talking to the Minister of the Environment, the Minister of Transport and local government. Because the three of us can do more. Probably tomorrow. And in time, we get shade and a nice environment. And it matters. We can use the streets by opening them up, having days where people can cycle and walk. This is Bogota in Colombia. Every Sunday, every public holiday, the streets are opened. 170 kilometres are opened for walking and cycling. This is reusing streets, just closing it. And the Department of Sports is involved in providing programmes and helping facilitate that. So our evidence in this area is particularly strong, but we're not doing it. So our levels of physical activity are going down. Oops. I want to now show you that we have really good evidence in 7 areas. And this was summarised in a nice document. If you're not familiar with it, you can get it from here. The 7 investments on physical activity. The 7 investments are shown in this pie. And each one of them speaks to a sector very quickly. We do need to educate. And of course, New Zealand has done some of this already, but it needs to be continuous, it needs to be tailored, it needs to be culturally appropriate, it needs to target. We know how to do that well. We need funded programmes. We need to have healthy schools. We know how to do that well, but not in one school, all schools, primary and secondary. The sorts of things in curricula, in the playgrounds, in the links with the community, in after-school programmes and travel-to-school programmes. In the workplaces, lots of tools and recommendations and advice and experience on how to do it well. In the healthcare setting, again, New Zealand has led in this area with things like the green prescription. It works. We need to keep doing this. And in the area of sport, we need to walk with our sports partnerships, and that's where I was yesterday with Kay Thompson, talking to sports sector, speaking to them about how they can help with our agenda on promoting physical activity. Promoting physical activity such as having programmes that aim at sporting fans. Here from Glasgow, football fans in training, run by the University of Glasgow, with the Glasgow Rangers, a very popular football team. And what they've done is create a programme to attract middle-aged, fat men. And it worked. Quite remarkable. These are people who were not turning up at what the health service was doing. Nice obesity programme over there, must be for other people. Quit Lines and the NHS, they were not, not Quit Lines, the commercial programmes in the NHS, they were not participating in those, as you can see from here. And then the results in weight loss, short term, and what's most impressive, 12 months later. Results in physical activity in the short term, 12 months later. So we can see ways that sport can reach out with their facilities, with their pull, with their attraction, with their football stars. We could work with the football clubs here, other teams here, and create programmes to reach the people who are not coming to other venues. And this programme's now got €5 million and is being implemented in many countries in the European region. One more programme from the sports sector you might be interested in is the Your Move in Western Australia, sports working with transport and health in the city of Canning. Maps, tools, resources delivered to every household, showing them where to be active, providing them the advice, giving them a gym voucher, giving them access to the bike shops that are there with a voucher to hire a bike, and it works. Whole of community interventions. But it's whole of community interventions aggravated to a national intervention, a national strategy that really works. And I'm showing you here many countries that are working on this agenda. National policies, national action plans, partnerships, and working together. However, I've heard about the sports sector, and I hope I'm going to hear about the national action plan from the health sector for New Zealand. I hope I'm going to hear about one, because I didn't hear about it yesterday. So all those here who I might need to speak to, you need one. You need one to unite and bring everyone a direction and a target and collaboration. Now, in the interest of time, I'll skip over that because I know you're interested in what WHO is doing, and I have about 5 minutes, 2 minutes. Let me just quickly cover. I've told you a lot about what we're doing in terms of our boring stuff. We develop the norms, standards, programs, and technical advice. So what's the really interesting stuff? Well, the really interesting stuff is we're going to work on the guidelines for under fives. That came from the ECHO Commission. We haven't got guidelines, and I believe New Zealand today, tomorrow. Today. Is it today? Today you are launching your under fives guidelines on movement, sleep and sedentary behaviour. World leading, excellent work, and we hope that WHO can learn from what you've done to also provide that information at the global scale. So very well done. I've mentioned that. We're going to be working on the global strategy. It's very important, as it is for New Zealand and it is for globally, to have the sense of direction, a roadmap. What works and what are we going to do for the next 5 years to make a difference? And that task has fallen to me to coordinate. And I'm looking forward to it. It's an enormous task because of the timelines. We only heard in January that this was a mandate for us to do, and we have a very short time frame to deliver it. Across 2017, we'll be consulting with countries. I look forward to any comments you want to give me at lunchtime and throughout today. We'll be consulting with sports sectors and other agencies to get their involvement and their advice. And we have to deliver the Global Action Plan draft by October, because it goes into the World Health processes for this time, perhaps even this day, next year, just like we heard on ECHO yesterday or this morning, that we will launch and have the mandate to help countries implement. It's important because it brings the media, it brings ministers, and it brings profile to our issue. So these things provide us a roadmap at a tangible level, but they provide also the political focus which we so desperately need. What might be in that action plan? Well, of course, typical stuff like a goal and a vision. And then we've got to focus our efforts on 5 or 6 key areas, provide guidance and evaluation frameworks. We'll be supporting that with a toolkit. And this is a toolkit that some of you may have heard about previously, but it's under development now. It's going to have advice in what policies, what programs, in what environmental changes to make across the different settings. I've given you some examples already. So this toolkit will actually come out and be launched alongside that action plan. And to finish, all of this has got a very sharper focus given the Millennium Development Goals. A set of 17 goals agreed by governments, heads of states, New Zealand signing up to achieve these goals. And number 3 is improvement in health. Number 2 is improvement in nutrition, ending malnutrition, all its forms, which includes obesity. And this provides us with new leverage. How does physical activity fit within this? So one last resource I want to show you is that we've been thinking about this goal, thinking about this agenda and its political importance, and we've created the Bangkok Declaration, short, sharp and strategic, which you might like to use, 4-pager, that introduces the Sustainable Development Goals and how physical activity can contribute to achieving those. And I'm hoping some of you will come to the session this afternoon to discuss that in more detail with me, how we can work together with other sectors and use this document to support our work. Here are the sectors that we can work with to achieve improvements in equities, in education, in the environment, healthy cities, etc. So I would like to finish by saying we're not alone, because the sports sector produced their version of how sport can complement and work to the Sustainable Development Goals. So a very close partnership should start to develop between health and sport, perhaps around some of these agendas. And so if you'd like a tool to assess how you're doing here in New Zealand, in your region, in your city, this is a tool we developed which allows you to ask yourselves the question, are we doing? And then complete it and use it as part of a partnership building tool. Complete a self-assessment on your progress on physical activity, your challenges, and then set a plan of action together. I've given that a very brief introduction in the interest of time. I'd be happy to talk about that over coffee and later on throughout the day. But another resource, an awful lot of information given you to help you in promoting physical activity. I've shared with you the big picture of communicable disease, non-communicable disease, and its importance now as a primary cause of premature death. Physical activity and diet are central. Tools are there to help you. And our agenda is a large one. 2025, 10% improvement in New Zealand. I look forward to working with you to achieve that. Thank you very much.
Thank you, Fiona. Isn't it so nice getting a standing ovation after a presentation? We might just have time for quick questions, a couple of questions for Fiona. If not, you can tackle her at coffee. Kia ora, Vishal.
Thank you very much for your lovely presentation. My name is Vishal. I live in Auckland. But I need to admit, when I come to Wellington, I walk more because of a lot of walkways and the environment which you just spoke in your presentation. Thanks for sharing those thoughts. I have many questions. Very good. Just one question I would like to ask. It seems to me that physical activity and nutrition are two members of a family and they don't talk to each other. They don't. I'm just referring back to your comment about the richer people are less active than the poor, but I think we know they have a better nutrition. However, it's vice versa in the other case. So how we can make that work? Because we need both to be active. So physical activity and nutrition both are important for all the communities, for rich or poor, you know. So how we can make that work?
Well, you're quite right. They are part of a family, but the agendas have differences. For example, when we're talking about providing the walkways and the environments to support physical activity, we need to have those partnerships in the industry, in the sectors of transport, environment, parks and recreation. And equally, those working on unhealthy eating will be working with the food industry, looking at the strategies to provide more accessible access to fruit and vegetables and other healthy eating choices. So we have two agendas joined, and in each country there are the mixture, and we have to understand the country context and to know where to invest and where to prioritise. But arguably we're going in the same direction to promote adequate and appropriate physical activity opportunities for everyone across the life course, and good food, healthy food options for all. And that's what we're all aiming for.
Fiona, thank you very much for a wonderful presentation. I'm Ruth Richards, and I'm from a local public health unit, one of the workers on the ground. And I'd just like to put in a plug for including mental well-being into physical activity and nutrition. I've just read the listener. Tells me all the things I've got to eat. A list of about 25 nutrients, micronutrients to get my mood better. I think walking around the block would do it just as well.
Yes. Yes,
So
yes.
just a plug for when
Thank you
you're
very
doing
much.
your work.
No, I couldn't agree more, and thank you for raising it because it's very important and another opportunity for us. We have with physical activity connecting points across many health issues. We haven't mentioned prevention of falls, independent living, healthy growth and development in under fives, but the mental health must not be forgotten. Can I draw your attention to the Lancet article 2016 on the evidence that shows physical activity can delay the onset of dementia? A new area of research measuring the mental health in its disease states or its mental well-being is difficult, but they were now finding methods and linking that to explain and understand the role of physical activity. But I think at one level we all know it. You do feel better when you go out for a good walk in fresh air, and that's one of the simple ways. Walking is such a simple way to promote physical activity. Thank you for the question. Yeah.
Morning. Hi, Fiona. I was just wondering, when you talked about the 10% reduction in inactivity goal, what's the WHO definition of inactivity? Because I know in Britain we used to say it's actually people not meeting at least 30 minutes of at least moderate intensity physical activity, but is it not meeting the guidelines, what you're talking about?
Yes, I simplify it for the purpose of just being easier to say that meeting the global recommendation of 150 minutes of moderate intensity exercise or equivalent minutes is the recommended global recommendation, the same as the UK, Australia and other UK, Canada, US, Australia and I believe New Zealand. So it's the same recommendation, and you're active if you meet that threshold. You're inactive, 1/4 of the population is not meeting that threshold. So if you remember that graph with all the lines going down and the big recommended, the earliest part, the focus is for all of us to get more people reaching that threshold. Support those others who are already doing some activity. And of course, more activity is desirable. But our best public health buy is by helping the quarter, or here in New Zealand, the 50% who are not meeting physical activity guidelines to get there. And of course, the adolescence is meeting the adolescence guideline. One last question.
I was interested, richer countries are more inactive, but in the data that you showed in the poorer countries from the Pacific, we're also quite highly inactive.
Yes. Yeah.
So how do you read that?
We understand that in richer countries, of course, they're changing lifestyles and the environments, the urban sprawl that I pointed to, the changing nature of work, which is explaining how we're less active in getting around places because we drive, at our work because it's sedentary, and we're not choosing to be active in our recreational time. So it's those societal trends and changes that are taking place in developed countries, but they're also taking place in cities and places in developing countries, with the added issue that in some cultures the desire and focus is on other activities, and using your recreational time to go for a long walk or even a run or play a sport is not necessarily seen as important. So we're seeing this patterning of physical inactivity influenced sometimes by changes and environments, and then oftentimes in other countries by the cultural norms. So look at the Middle East. A country which has got higher levels of inactivity, extraordinarily high levels of obesity, and the cultural norm is to not do a lot of activity. They have a lot of servants and drivers, and the restrictions on women to be active in many places means that we have a system, as Boyd would say, a system which is conducive to inactivity and overweight, and a big challenge there. So it's very interesting to go from global down to the local in understanding, local in implementing. I think that's
Excellent. Thank you very much again, Fiona. That was excellent.
Thank you very much. Thank you.